Hello everyone, this is Dr. Sharon and you're watching Easy Vet Anatomy. In today's video, we're going to study about femur bone in different species. Femur is the most massive of the long bones, which is extending obliquely downwards and forwards between hip joint and stifle joint. So it forms hip joint with oscoxae bone. This part of the femur, called as head of the femur, it articulates with the acetabular cavity in the oscoxae or pelvic bone, and this part of the femur, called as trochlea and also the condyles, this articulates with both patella and tibia to form stifle joint. So as we have discussed, this is a long bone. It has a shaft or diaphysis and two extremities that are called as epiphysis. This is proximal extremity and this is distal extremity. Proximal extremity, it forms hip joint with oscoxae, and distal extremity, it forms stifle joint with patella and tibia. Coming to the shaft or diaphysis, so as you can see, this is the shaft. It has four surfaces: anterior surface, medial surface, lateral surface and posterior surface. How to identify which is medial and lateral? Always remember, head of the femur is present on the medial aspect. So this forms the medial surface. This is the lateral surface, anterior and posterior surface. Anterior, medial and lateral surfaces, they are continuous and convex from side to side. So these three surfaces in life, they are covered by a big muscle that is called as quadriceps femoris muscle. And this posterior face, this is narrow in the middle and it is rough. So this rough area is for the adductor muscle. And below this, you can see here one vascular groove. So this vascular groove or impression, so this is for the passage of the femoral vessels. And you can see there are two borders. So as this is the head, this is medial side, medial border and lateral border. This medial border in its upper 1/3, it has some rough area or protuberance. So this is called as trochanter minor. So this trochanter minor is for the attachment of two muscles, that is quadratus femoris muscle and iliopsoas muscle. And extending from this trochanter minor, you can see an oblique ridge which is connecting one more protuberance. This is the largest one, called as trochanter major. So the ridge which is connecting trochanter minor with trochanter major is called as trochanteric ridge. So this ridge, it provides space for the attachment of gluteus medius muscle. And here you can appreciate there is one fossa. This is called as trochanteric fossa. So this trochanteric fossa, it is for the attachment of three muscles: gemellus, obturator externus and obturator internus muscle. So this trochanteric ridge, it is forming posterolateral boundary of the trochanteric fossa. And this border is lateral border. So this lateral border in its distal third, it has a fossa here. So this fossa is called as supracondyloid fossa. And this supracondyloid fossa is for the attachment of a muscle called as superficial flexor muscle, that is superficial distal flexor. And you can see here, lateral to this supracondyloid crust, there is one more crust. This is called as lateral supracondyloid crust. This crust is for the attachment of lateral head of gastrocnemius muscle. Next, discussing about proximal extremity. So this proximal extremity, it is having a head and trochanter major. So this head, it articulates with the acetabulum of the oscoxae, forming the ball and socket or hip joint. And you can see in the middle of the head, there is a small non-articular sulcus. So this is called as fovea capitis. This fovea capitis is for the round ligament of the hip joint. So this trochanter major is very massive, and this provides attachment for a muscle called as gluteus medius muscle. So this trochanter major, here in the lateral face, you can see two rough tubercles. So this is the upper one and this is the lower one. The upper one is for a muscle called as middle gluteus muscle, and the lower one is for deep gluteus muscle. Coming to distal extremity is comparatively larger than the proximal extremity, and it is having trochlea in front and condyles behind. These two are called as condyles, and this pulley-like articular area is nothing but trochlea. So this trochlea, it articulates with the patella bone to form a gliding joint, so which is a part of a stifle joint. And you can appreciate here two ridges. So comparatively, medial ridge will be larger or prominent, and the lateral one is comparatively smaller. Posteriorly, you can see condyles. These condyles are separated by a fossa here. This fossa is called as intercondyloid fossa. So this intercondyloid fossa, it articulates with the tibia, spine of the tibia. Whereas the facets present on the proximal extremity of the tibia, it articulates with the condyles through a medium of interarticular cartilages, that is also called as menisci, which is made up of fibrocartilage. This medial condyle, it presents an eminence here. So this eminence is for the attachment of medial ligament of the stifle joint. Similarly, on the lateral condyle, you can see two depressions. So this is the upper depression and this is the lower one. Upper depression, this is for the lateral ligament of the stifle joint, and the lower one is for the attachment of popliteus muscle. Between this lateral ridge of the trochlea and lateral condyle, you can appreciate a fossa here. This fossa is called as extensor fossa, and this is for the lodgement of complex muscle. This is the femur of horse. It is more massive. Same, it is having a shaft and two extremities. This is anterior surface, lateral surface, medial surface, and this is the posterior face. So here the posterior face in its proximal 1/3, it is having some rough eminence for the attachment of the biceps femoris muscle. Coming to the differences, you can notice here one extra trochanter or trochanter tertius. So this is called as trochanter tertius or third trochanter, which is located on the lateral border of the femur. And you can see here the trochanter minor, which is in a form of a rough ridge. And this is the trochanter major. Connecting the trochanter major and trochanter tertius, there is a vertical ridge. This is nothing but the trochanteric ridge. If you remember in ox, the trochanteric ridge, it connects trochanter major with trochanter minor, and that is oblique. Whereas in case of horse, trochanteric ridge, it connects trochanter major with third trochanter or trochanter tertius, and this trochanteric ridge is vertical. This trochanter tertius, it provides space for the attachment of superficial gluteus muscle. So in this lateral border, you can see here prominent supracondyloid fossa and lateral supracondyloid crest. So this trochanter major, it is having three parts. So anteriorly, it is having a convexity, posteriorly, it is having a summit, and laterally, it is having a crest. Let's discuss about the femur of dog. So you can see here the shaft, proximal extremity, distal extremity. Shaft is strongly curved and it is round. So, and it has a convexity which is facing forwards. In other species, if we see, trochanter major is larger than the head. But in case of dog, head of the femur is larger than the trochanter major. And here if you see this trochanteric fossa, it is round and deep, and you can see here two equal and sagittal trochlear ridges, and this is the intercondyloid fossa. Intercondyloid fossa is wide in dog. And the important point you need to remember here, so on the posterior aspect of distal extremity, immediately above each condyle, so here you can see one small facet. So this facet is for the sesamoids that are called as fibula. So fibula is nothing but there are two rounded sesamoid bones which is located one each on the condyles of the femur on the posterior aspect. So actually these are developed in tendons of origin of the gastrocnemius muscle. Coming to the femur of fowl. So here you can see the head, it is more prominent, but it is smaller than the acetabulum. So the articular area, it includes both head and also the trochanter. So trochanter and head both articulate with the acetabulum to form the hip joint. And one more difference is, you can see here the two condyles, this is medial one and this is the lateral one. So this lateral condyle, it is having a groove on its lateral aspect. So this groove is articulating with the head of the fibula bone.
Thanks for watching. Do follow our page Easy Vet Anatomy for more anatomical videos.